Wonderful. Hello, everyone. My name is Dr. Emma Shapiro, and I'm with the Alternative Healthcare Careers Group and Business. And I'm so excited here to be with Sakis. I'm abbreviating his name because it's quite a long name, and he is the director of the USF Health Informatics program. And I'm so excited to have him here because he's going to dive into first what is health informatics, a day in the life, some different career paths, and who can get started in this career path. And then he'll also dive into some great educational opportunities that USF offers. And we actually have a student right now in your class specifically. So she said lots of wonderful things about you. And Patty has been one of your students, and she's gone on to have a wonderful health informatics career. And so this is a path, if you're listening, if you're a nurse, a physical therapist, an occupational therapist, in healthcare, anyone in healthcare, this is a great route for you. So, with that said, thank you so much, Sakis, for being here.
You're very welcome, and thank you for inviting me. So I'm gonna, as you notice, I'm gonna talk about, as you already said, I'm gonna talk about what is health informatics, what informaticians do and don't, the competencies that I have been described by different organizations on what these health informaticians should know in terms of skills, attitudes, and knowledge. Um, then discuss a little bit about the positions and the career landscape. And finish with, as exactly as you said, with education opportunities. But this is a slide that says about me, and obviously this is my pre-COVID phase. My whole name is Athanasios Tsalatsanis. I am an associate professor with the Department of Internal Medicine at the College of Medicine here at USF Health. And I'm also the director of the Health Informatics Master's Program. So my day here, I'm teaching 3 courses specifically for the Health Informatics Program, but I also do research. And my research is focusing on decision support systems and medical decision making. And lastly, as any academic faculty, I support the department with my service, and I'm providing health informatics services like getting data for researchers in the College of Medicine, uh, working on analysis, which is not exactly what health informatics do, but working on data analysis and statistics for supporting papers and in general research. So the I wanted to bring the definitions because we always need to have a definition of what informatics, health informatics is. But it's complicated, but I'm hoping to make it a little bit more specific and easy to understand. And I'll start with the second actually term in the health informatics, which is informatics. And what is informatics is in any domain, not necessarily in health, is a field that is an overlap between the information science, computer science, social and behavioral sciences at the same time, and focuses on how we use information, how we study information, and how we use it to do something good, to improve something, to make something better. And at the same time, we do that with the use of technology, with the help of technology. So the emphasis of the informatics field is to make sure that we get information and we use it to make something better, but at the same time, make sure that people are using it, right? We have to make understand that people, machines, and data are integrated at the same system, let's say, and provide something like improvement of some service or a product or a system. And so that's what informatics is. So when we apply the informatics field in a specific domain, then we can say that it's okay. Health informatics is the application of the field of informatics in healthcare. Kind of. And the kind of is because there are so many different groups that work on informatics, and the definition is so evolving that it keeps changing depending of who is creating it. But and the earlier definition was the application, as I said, of the informatics field in healthcare, in biomedicine, right? But the one I like, and it's more recent in 2018, it's very specific, and it's the field that uses information and it's concerned with the optimal use of information, how we best use information assisted by technology, obviously, right, to improve health. And health either at an individual level, either at the healthcare nation level, or public health, or in general in biomedical research. And health informatics, many people categorize it into three areas, either biomedical informatics, public health informatics, and clinical informatics. And the clinical informatics is then also subdivided in specific domains like nursing, pharmacy, clinical research, consumer health. There are others like cancer, like dental. There are so many very specific to a domain.
And what are those, I don't know if you have a slide about this, but what are some of the differences between biomedical, the public health, and the clinical side?
So the biomedical is the data that we're using there are more genomic data,
Okay.
right? Public health is at the level of the public, state level data, and clinical is more specific to patients, right?
Gotcha.
So that's the main difference. So at the end of the day, it's how we use information related to a specific domain with technology to make something better, like improve my health, my personal health, or the community health, or something like that. And this is important. And the reason that this is important is because medicine cannot be performed anymore without the use of technology. There is so much information out there. We have to find a way to use it, to actually use it, because if we don't have the systems to support us with information, then we don't even know that we have the information. So we need informatics. And it's so important that the Institute of Medicine originally said that in 2011, I think, they made a report and they said, look, all healthcare professionals, everybody who is involved in healthcare, they must have a competency in health informatics. And by competency, again, I mean knowledge, skills, and attitude towards health informatics. And this is not to be confused with literacy of technology. I mean, knowing how to use computers does not mean that I'm good at informatics, right? So again, how to use information with technology to do something good. And then we have the American Academy. I was looking for that a couple of days ago when I was preparing the presentation. I saw specifically that the American Academy of Physical Medicine and Rehabilitation, as well as the American Physical Therapy Association, they both have in their journals, in their respective journals, they have calls for establishing competency in health informatics within their education systems, right? Which is, yeah, I mean, that's what is expected. So when I'm trying to describe what health informatics professionals do, I think it's easier to describe what they don't do. Because many people, especially in clinics, when I have interactions with medical students, they think that informaticians are the people who fix computers. They're not. So if you're in a clinic and the computer breaks down, you cannot call an informatics professional. They won't help you. They don't know how to help you, right? They don't necessarily do statistical data analysis. I mean, they do something, and we'll talk about this, but it's not their primary work to do statistical data analysis for research or for any other reason. There are other specialties for that. They don't do data entry. For example, somebody is not going to give me a paper-based medical record that they had 10 years ago and ask me, hey, Sakis, take this and put it in the electronic medical record system. No, they don't do that either. They don't install or troubleshoot software. If I need Word in my computer, or I need either an Explorer, or I cannot call an informatician, they may not know how to install it. And definitely they don't, actually, that's not definitely, but health information management, they don't do the work of a health information management professionals, which is very close disciplines, but very distinct. So the health information management is a much older discipline that started even with paper-based medical records, right? And they are focusing mostly on how we manage medical records, not how we use information, as I said, to improve care delivery. So that's a big difference there. And usually the health information management is mostly nurses who are proficient in that, because they are the primary users of EMRs. So now, the difficult part is to explain what they actually do. And that's difficult because it's so vast. It's so many things that they do, so many things that have to do with technology, improvement, healthcare, clinical workflows. So it's difficult to say that that's what you're doing. But at the end of the day, an informatics professional is a liaison between the practitioners, clinicians, the administration of an organization, and the departments of information technology, information systems, and many times the vendors. If I had to use one sentence to say what they do, is that they support all the aspects of life cycle of any healthcare technology system. Meaning, I have to identify as an informatics professional a problem in my organization. And I don't have to identify myself. One of the clinicians comes and tells me, hey, we have a problem with this specific workflow. It doesn't work. It takes forever. What can we do? So I, knowing, or my team, right? Because this is very complicated implementations, and they require teams of people who are, these teams are usually interdisciplinary with different skill sets and better understanding of specific domains within the informatics profession. So I'm going to talk to my team and say, okay, let's figure out how to solve this problem when with the use of technology, right? So then we will have to use our operational and clinical and administration knowledge that we have and create the specifications for a system that address all of these requirements that we have to develop, and then create a system, see implement it, and see how it works. So that's it, right? And I'll give you some examples there later. So the main one that actually started the profession of health informatics is the implementation of electronic health record systems. Before that, majority of the hospitals, if they had an electronic health record system, it was mostly for billing purposes, and all the patient data that we could use to improve something like health outcomes, let's say, they were kept in paper forms. So there was a big investment from the government to help create electronic health record systems within all organizations, technically. So informaticians, first of all, identify the requirements, as I said, in the life cycle, identify the requirements. Again, operational requirements, clinical requirements, administration requirements, legal requirements, to start developing electronic health record systems and implementing them, and then see how they work and how they can improve healthcare many years and many people. It's a humongous undertaking, but it's good because the majority of the hospitals now, they have electronic health record systems. So what informaticians do, they add on them. So, for example, another one, it's analyzing clinical workflow and propose improvements, right? That's what I've been trying to say too. I have a clinician, we see when we go to see clinicians, what they do in practice, they spend time typing. They don't talk to the patient. The patient is sitting there and the clinician has to type. So that's a problem. That's a problem with the workflow of seeing the patient. So they come to me, or not to me specifically, but what I'm talking about, and they say, look, we cannot do that. We have to find some better way to do that. Let's figure out what we can do. And for example, there is a system that supports dictation of notes. So instead of typing, I'm dictating. So how can we integrate this system that is foreign to our electronic medical system through our electronic medical record system? So that's a system that we're thinking about building, implementing, and then assessing whether it works or not. Other things they can do, develop clinical decision support systems. So within, again, the electronic medical record systems, we may have the most popular thing that we see is creating alerts. So the electronic medical record system has access to all the data of the patient. So if we create an algorithm that uses this data to to identify patients with high CVD, cardiovascular disease risk. That's something that can help the clinician if they haven't noticed that there is a high
Gotcha.
risk there. Say, hey, watch out! There is a problem here. Make sure that you do this and this and that. Give exercise regimen or more resources, and all these things have been done, but we keep building these kind of systems
And
too,
optimizing them,
and
exactly.
optimizing. Yeah, definitely, because that's the other problem. Because we did so many of these, now there is a fatigue of alerts. So there are so many alerts popping up, so that the clinicians they don't pay attention to that anymore. So even that is something important that we are working on to fix this optimization, right?
Now, are
We
you coding that, or maybe do you come up with that idea and then you give that to someone who has a more like coding or technical background?
Yes. So for the, I would code it myself, but I'm more in the research aspect of this, so I can do it. But as a health informatics professional, they just they would just need to understand what we need to collect, where can we find it, how we can create the data sets that are necessary for this, and then we go to the analyst or the person who will implement it, or the person from the IT department or from the IS department, from information systems, or the person in our team who is responsible for coding and code it,
Gotcha.
right?
Gotcha.
Yeah, I went the whole route. Um, Other things they do is supporting research. One exciting, very nice article I found a couple of days ago. It's from a department of rehabilitation. And these guys, they identify the problem with COVID, that we cannot support the physical therapy of patients if we cannot see them. So what they implemented was a telehealth solution, and they implemented it, they tested it, and they concluded as a research project that, look, it works. So that's something that health informaticians will have to help them build and assess. We also have reporting. Every organization has is required by the government to report some indicators, performance indicators. So where do we get this data? How does data have to be converted? How do we calculate these indicators, and how we report it? Again, something that informaticians can do. And lastly, one important thing, it's not lastly, I mean, that's what I was thinking and typing, because it's so, as I said, it's so vast, so many different things that we can do with information and technology, and the needs of organizations are varying. So it's the sky's the limit, I would say. But one of the things that happens is every time you change something, every time you change a workflow, every time you change a system or implementing new systems, you have to educate the people who will be using this new technology. And there is usually a problem when we change somebody's workflow, they are not very happy about it. So there is a better way to do that, and to explain how, to educate how to use this technology.
That is me. Every time you update something, I'm gonna be so mad. I hate
I
it. Keep
know,
my
I know.
email the same. Keep everything the same.
I'm
Um,
I'm like that too. I'm like that too. I've been to that point now that I don't want to do anything change. Don't. I have so much, and that's everybody. I mean, we have so many tasks in our regular lives, in our professional lives, that retraining us for something while we're doing the task we have to do, it's very difficult. So we
exactly.
have to take that into consideration as well. And this is summed in the I think, yes, these are the all these things that we discussed are they are uh, they can be achieved by specific competencies that the health informatics professional has to demonstrate. And these competency specific ones are being described by the American Medical Informatics Association. And they have obviously understanding of the healthcare setting, a little bit information technology, um, leadership, professionalism, interprofessional practice, and social and behavioral sciences. That's important. That becomes much more important now because of all these disparities that are happening in the healthcare. For example, let's say in the example I was giving you earlier with the telehealth system. We build that system to help our patients do physical therapy remotely. Do they have computers? Okay, let's say that we focus on people who have computers, or we are very risky hospital and we have 1,000 iPads, and we wanna loan it to our patient groups, right? Do they have internet? So you see all these problems that if you have not thought of that, or you don't have understanding of all these social and behavioral issues that are happening, you will develop a system that is not useful. So, but all these competencies, in reality, it's something that every healthcare professional has.
Yes.
You have an understanding of healthcare, right? You have an understanding of, you know how to work with communications, right? You know how to communicate with patients, with colleagues. You can build leadership skills. So what I'm thinking is that the more important things of health, the more important skills of a health informatics professionals are understanding of health, understanding of IT, of technology, of what you are trying to build, communications, and that's learnable. That's something that you can learn. But the things that are more difficult to achieve are communications, which is important, leadership that you can build to, and all this, the combination of all of this is one course I'm thinking, and I'm thinking in terms of project management. Because if you're a good project manager, you have to have all of this included in your projects.
Well, this is really helpful because I have to admit, and everyone, if you're listening, let me know if what you thought health informatics was. And really, even though I've chatted with Patty, I still really didn't understand what health informatics is. And so this has really helped me understand almost like a day in the life. Like, what are the problems that we're solving? What are we actually doing? And it also helps reinforce to me that honestly, any nurse, any PT, any assistant, any OT, any speech therapist, like any health professional can do this because we have all these different, I'll call them like soft skills, all these different soft skills, and we have a very firm understanding of healthcare. And I'm sure that we've been doing this. I mean, you talk about troubleshooting healthcare professionals without being in informatics. We're constantly troubleshooting and trying to come up with fixes and workflows ourselves. And so I feel like this is awesome information because it tells me that anyone listening right here, this is such a doable pathway. And what I really love to talk about are pathways that are like a natural transition for healthcare professionals. And I feel like this is really becoming an seeming like a natural transition with all the strengths that we have. We're carrying them over to this career route.
Definitely. And what I've noticed is that usually people who have one specific career, they are afraid that when they move to the next career, it's like they're kicking away everything from the past. And that's not true, especially in this case. You have your career as a physical therapist or occupational therapist, and you are building on that with more skills related to technology, and see how all these things together can help patients at the end of the day.
Exactly.
And that's the main push here, that you're building, you are enhancing your education. Is not you are kicking away the old things to move to something new.
Yeah. So hopefully everyone listening, we got a heart for that. And I agree, like feel the empowerment. This is a really great opportunity. And so hopefully we're helping to one better understand this route because we want to help you understand, is this the right route for maybe your personality and your goals, but also to empower you that you can do this. I love
Yeah.
it. Keep it going, Sakas.
And
You're doing
yeah.
great.
And the thing now is that there is you may have seen that the majority of the of these positions is many actually of these positions are held by nurses, and that's some people are thinking that that's only for nurses. It's not. As you said, all healthcare professionals can do this job. Nurses are there because they were the first to understand that we can do that. We can do this. We do it all day. So why not? And that's what's happening. But the need is so big. The need is so big that you will find now many universities that are offering bachelor programs without healthcare background, right? So they are building the informatics people from bachelors now. Uh, in our program, we're working mostly with professionals who are already in the field. But that's not enough. We need more. We need
Yes.
more, and how we can create more is by taking the entire field, the entire aspect of education, right, from bachelor's and master's and PhD programs to create informatics professionals.
I love this. Let's stay on this point just 1 second here, because this is so important. And this is one question Sakis and I beforehand were like, we've got to address this. Is, just to highlight again, he's saying it doesn't just have to be nurses. This can be anyone in healthcare. Now, we have a lot of assistants, so physical therapy and occupational therapy assistants too. Do you feel like they could go into this career route as well?
Yes,
Awesome.
yes,
Awesome.
yes,
And then one last
yes.
question for you. Do you find, and this is maybe a challenging one, but you know, hiring, do you find that there's any sort of preference between like, oh, this is a nurse who has this health informatics degree versus oh, this is a therapist or assistant?
I would think that most organizations will be looking. The first thing they will be looking is nurses. But again, there is so much need now out there that there is not even enough nurses for that. I was looking for jobs before I made this presentation. I was looking at Indeed and see Baycare has positions for health informatics specialists, and they list nurses, physical therapists, occupational therapists, audiologists. And I printed it actually. I print audiology, speech therapy,
Nice.
respiratory therapy, and I haven't printed the rest of the page.
Which
So
company was that, Sakis?
Baycare,
Oh, Baker.
Baycare.
Got you. Got you.
So it's and that's one only, right? I mean,
That's awesome. See, there you go. That's wonderful news. Thank you so much for looking at that. And that's so exciting because I know, that's the biggest fear is yes, we can maybe do this. Yes, we'll get the degree, but is there still going to be that preferential for nursing? And what I want to say too on our side, we've helped so many people get into utilization review and utilization management, and we've felt the same barrier. And no offense any nurses listening, we love you too. Um but there's been a barrier for therapists and assistants to get into those roles. But the more they've gotten into those roles, it's broken away the barrier and enabled more and more of us to do it. And so, take that leap and do this, and it will help everyone that comes after you too. And we just have to start proving that we can be just as skilled because nurses are really good on the nursing side, but there's therapy, there's huge rehab divisions, and rehab pulls in billions of dollars for these healthcare industries. And so, our specific rehab workflow knowledge is so valuable. And so, when you go into those interviews, that's really what you have to do is you know get the degrees here, get the education, which Saks is going to talk to you about, but then highlight that you are really perfect for that role because of the certain experience you have. And we all have strengths. Nurses are for those nursing roles, but we can really work great in the public health and the rehab roles and even go beyond. We're not just limited in nursing because what Sakis is saying, there's such a deficit in these roles that they're going to just be taking everyone, which is great.
and I'm thinking also for the domain of rehabilitation is untapped. Rehabilitation informatics is untapped. We don't know what kind of systems you can create to help with rehabilitation, right? Which is not the main concern of other domains, but it can be yours and build on that.
Yes, exactly.
So typically, informatics professionals work in hospitals, but they also work in pharmaceutical and insurance companies. Definitely government, CDC, CMS, they're there. Some of the titles that are there, and these are, again, they expand a lot, right? Either health informatics specialist, expert, consultant, coordinator, or a domain, nursing informatics specialist, expert, consultant, or coordinator, pharmacy informatics, or at this type of position, I guess. Others that are available, I've seen, is education and learning specialist for informatics and informatics analyst. So these are entry positions, I would say. After you finish your masters, that's something that you can start with. But it's there is a growth. There is a lot of growth, and as I said, that's informatics are teams. They should be teams at least. Some smaller organizations they have one person who does everything, but yeah, some bigger organizations they have teams because they have realized what the benefits to the organization are having a team of informatics and analysts. So then you are able to, in the higher position, administrative position, you are able to manage teams of informatics. And I'm focusing mostly on clinical because that's what my job here, my research, my service is. Director of clinical applications or clinical informatics. And applications is specifically to designing applications that are systems, as I said earlier, right? And even higher now, chief information officer, chief information informatics officer, chief research information officer. That's a very high level. So there is growth, definitely growth. And again, in terms of salaries, I was checking earlier again, and I'm looking for the entry level positions again vary. So it's something between 60 and 120. I've seen the entire range there. The administration positions are on 40, on 50 to 100. Yeah,
That sounds good
that's
to me.
different. Yeah, that's yeah. So there is growth and there is money. Well, it's I like
And
it.
it's a
I like
stable career, right? Like, because one bad thing about healthcare that many of us didn't realize when we got in is they will flex us off. So if we don't have a big enough caseload that day, which isn't in our control, sometimes they will have us go off and they won't pay us for that time. It's a very big stressor in healthcare that, we're not really told until too late. But with informatics, that this is also a very stable position, usually full time, usually regular standard hours, correct?
Yeah, it's a very full day,
Nice.
full day. It's very busy. Yeah, but it's good. It's nice because I'm thinking mostly in terms of trying to find, not trying, doing something new every day. When you do something that improve something in healthcare, and that's a good goal to have. And there is no one boring day. I think it's nice. So in terms of career, yeah, development, yeah, anything that has to do with healthcare is expected to have a humongous growth, and that's been for a while now. And anything that includes positions that have to do with information technology and informatics, and that's to the general vicinity of informatics. And we see that there is growth, there is expected growth as well. And now I'm thinking that in my area there are three new hospitals now. Three new hospitals are expected to open in the next 3 years. That's gonna be that's a lot of people to
Oh,
hire.
definitely, definitely. Well, and even, it's funny, but, I have a lot of people with utilization review, and I can see them needing informatics too because they do so much in healthcare. And so they work on sort of the appeals and denials and like approvals. But I can see informatics definitely being roles that maybe that eventually these other companies that are utilization review companies utilize just to help with optimization too on sort of that billing insurance approval side.
Yeah, definitely. Yeah. So in terms of education opportunities, as I said, there are several universities that they start offering bachelor degrees in health informatics, but at a little bit higher level as a master's uh, education. There are, again, several universities. We are one of the first who started offering a master's degree in health informatics, and it's 100% online. Many universities offer online programs. Some offer a hybrid online and on ground programs. Um, so the way we have designed our system, our master's degree, it's, as I said, completely online, and it has 32 credit hours, so that's 11 courses, and you learn everything that I described earlier in terms of competencies, and through these 11 courses, right? We offer courses 6 times a year, So you can start in January and finish in January of the next year if you double up on courses. Um, Typically, our graduates they take 2 years to finish the program. Within the master's program, we have a certificate in health informatics that is only for the first 4 courses of the program to just to fill the area, see if that's for you or not, and then you can continue to the rest of the degree. What else? Every course is 8 weeks long, so you can finish a course in 2 months. And there are many benefits with online education as well. But we also have a specialty within the health informatics program, which is an analytics concentration. And the healthcare analytics concentration focuses mostly on the analysis of data. So it's not just playing with information and see how we use it, but also how to derive the information as well. So that's a subspecialty of informatics, I would say. And it's
Wonderful.
exactly the same concept. Fully online course offered 6 times a year, 8 weeks courses, and we have partnered with SAS. SAS is a software company, statistical software company, one of the biggest ones. And yeah, we when students are taking our certificate, it's a joint certificate with SAS, I would say. But that's our program. There are many different other programs with, as I said, offer online masters in informatics. And in addition to that, mostly organizations like professional organizations offer courses, virtual courses on informatics. Either through the most popular is the 10 by 10 from American Medical Informatics Association, but also the other two organizations offer continuing education uh, courses, short courses for informatics. And
One question for you, Sakis. Can people work and take your program at the same time, or do you think that's too difficult?
yes, the majority of our students are professionals, so they do work. And the amazing thing is that many of our students are working, and they are seeking into getting a better position within their organization. So many also they get funding from their organization to pay for the master's degree. So uh, there are many people who don't even have to look for a job. They 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 are working in an organization in some capacity and then getting the masters and moving into the informatics team.
Wonderful. Someone asked, "Is your program fully accredited?"
The university is accredited
Okay.
completely, right? The university is accredited by the Southern University, South University, SACSCOC is called. I don't remember what exactly it stands for. It's a big one. It's the university accreditation for the Southern colleges. Yeah, we're public university, right? The program specifically, we went through the accreditation for the Commission of Health Information Management and Informatics Association, which follows the standards that are set by the American Medical Informatics Association. And actually today, it's the final meeting of board of directors to hopefully assign us the not hopefully, I know they will. That's what the understanding is, that uh, uh, give us the accreditation at the end of the day. And we went through that late, and it was a very interesting experience, by the way. And I'm very proud to say that when it was over, the review was over. From the reviewers told us that this is the first program they have to come to review, that there is nothing to comment. Everything was perfect. We can make improvements, but everything is amazing. So yeah, I'm very excited about that. So yes, we will be accredited with the Commission of Medical Informatics, with Health Informatics and Information Management Association. Yes, and yeah,
Wonderful. Well,
amazing at this.
congratulations.
Thank
I'm
you,
sure
thank
you
you.
guys worked very, very hard for that. So everyone
It
give a
was a
couple
year and
hearts
a
for
half.
Sakis and all their hard
Thank you.
work. That's really a big, big achievement.
Yeah,
Couple more questions about the program too. Do you help with do the students need to do any internships throughout this time, or do you help with finding any internships or
the
gaining more on work skills?
So this is a problem with online education that we have students from around the world, around the world, but mostly around the United States. So we don't have a relationship with everywhere. So the internship is we treat it as an elective course. So if somebody wants to do an internship, they have to find the area, they have to find the company that they can work with. And now the way we approach it, and that was one of the suggestions from the review committee, by the way, was to ask students to look for internships within the organizations already because they have these internships there. And that's much easier to set up a contract and have the internship happen. The problem with healthcare is that it's very um sensitive data, right? And this is a data and information profession. So there must be very many safeguards. So background checks and contracts and agreements that they make a little bit difficult the implementation of an internship. But
Gotcha.
regardless, um, we're looking into that. We're looking into figuring out how we can make it a little bit better because that's something that yes, we should be offering. We can offer to to uh, to our students. Another problem is that we are a very large program. We have probably in the program right now 150 students. It's very difficult to find internships, at least with our collaborators, the local collaborators, for 150 students. It's not operational. By the way, we have Patty, as you said. She's our star. I think she was the first who graduated with a physical therapy background. Um, One more graduated in spring. That is another stellar student. Seriously, she was really good. And I think that right now in the program we have 14 physical therapists that are
Nice. That's
going
awesome.
through the program now.
That's awesome. I know they've one of your students said wonderful things about you. I have a couple more questions, and Lauren's got a great question too. One question is, how competitive is it to get into your program? And then off of that, is there anything that people listening who want to get in should try to like do to better, you know, get their chances of getting into your program?
Well, the requirements for admission and by the way, I put our contact information up there to see. We have a lot of information on our website that people can see too. But the requirements for admission are very, very basic. As long as you have a GPA for 3.0 and above, and preferably coming from a healthcare background, that's a very good indicator that you will come. You will be accepted. Uh, Obviously, we don't accept everybody. We review a statement. We require a statement to see how well students are. They can write, right? At the end of the day, communication skills. We need to have something. I mean, if somebody cannot write anything, then it's difficult to go to a master's program and succeed. So we're taking that into account as well. How likely is for a person to succeed in this field? We not just admit everybody and see how it goes. And we are pretty good actually with our graduation rate and our the people who find jobs within 6 months of graduation. These rates are very, very good. And I know that because we have to calculate all this for our accreditation. That's just
So that's really great. So you have a really high graduation rate and then
Mhm.
a really high people who get hired rate as
Placement,
well.
yes, placement,
Wonderful.
yes. Within
Wonderful.
6 months, that's
That's
really
great. I
good.
mean, Patty got she was I think it was maybe even before, but she took like the certificate and then was sort of working and then she took the full program. And so yeah, she got hired like right away everyone really this is a career route where you can find jobs very quickly just because Saka said there's so much demand and it's growing demand and I really think this as one of these careers that is going to continue to grow, so you're in an excellent trajectory of growth and you're not limited by insurance. So you're not going to have the same salary caps that we all feel as therapists and healthcare professionals. And then there's upward mobility too, like Saka said. And so Lauren said hi. She's one of your students, and
Yeah.
and then she had a question for a friend, who's doing the graduate certificate program. So you know, what are the odds of people who just take the certificate program getting a job in informatics?
That's a little bit difficult. That's a little bit more difficult than the entire degree, but I think that the certificate is more for, first of all, people to understand, either people to understand where the field goes and how they fit with it, or people who have all the other competencies achieved by different specialties. For example, computer scientists, they know about technology, right? But they have no idea of healthcare. So they take the certificate to get an understanding of what the healthcare systems look like, and that helps them at least to put their leg in an organization and go from there. So it's mostly adding to
Gotcha.
some career that has the majority of the other competencies uh, achieved.
Gotcha. And the certificate is just 4 classes, so it's just sort of
Yes.
like a taste. But that being said, especially if you work like say in the VA already or in a healthcare like what Sakas was saying, take that advantage of, and if you're taking the certificate, see if sort of, talk to the university or the hospital and see if there would be any opportunities, and then perhaps what they can do is then help assist you in getting the full degree. I know this happens a lot in MBA programs, and I think it doesn't hurt to ask in this case too, because a lot of times people will be working and then the university or the program will pay for the informatics degree. I know, like the VA, especially for nurses, often pays for these additional schooling as well, and they'll sometimes do it for other people in the VA. So if you're in the VA, you could look into this as being potentially something that could be covered by the VA benefits as an employee, but doesn't hurt to ask. But I'm trying to think. Patty, I thought was working somewhere with the certificate, and then she got an even better job with the master's, I think. But I don't want to misquote her. Um,
Yeah, it's I found it amazing because we went to a conference last year, no, not before COVID, and one of our students came there too, and I met him face to face for the first time there. And before he left, he had 3 offers. He had 3 offers, and I'm like, maybe I should be doing it. Yeah, so I think it's good. I'm not trying to exaggerate, but I was seriously very happy with that.
you
It's a
should
good
be. You
it's a
should
good
be.
field.
That means that you have an excellent program. Let's see. Any other questions? So we went over, can therapists and assistants do this? And the answer, if you fast forwarded to the end, is yes. And you can get hired just as competitively as nurses and other healthcare professionals because it's a very growing career field where they can't hire enough people. And you have unique skill set in rehab and other things that you can portray. Oh, I wanted to ask you about remote roles or hybrid remote. How often are you seeing any sort of remote opportunities or like a mix remote where maybe they're sometimes at work and sometimes working from home?
Yeah, that goes back to the sensitivity of the data that we are working with. So some organizations, like insurance companies, for example, they set up secure links between houses and organizations, but hospitals don't do that very often. So because of the sensitivity of the data that we're working with, I don't see many remote positions for informatics. Mostly for maybe for analysts, but for informatics professionals, not that many.
Got you. Got you. And then we got a couple more questions. And hi, Kieran. Hi, Lauren. Hi, Kristen. What type of competency or licensure testing is needed?
There is a for informatics. There is not much licensing. The American Medical Informatics Association is creating now a certificate that anybody who has a master's from with health informatics uh, in health informatics area, or mostly, they can sit in this certificate. Uh, that's what it is. But licensing, there is nothing else. I mean, there is nothing. That
So
it's
after you
mostly
finish the full program, you don't need to take another, like, big test to get
no,
license or anything. I love
no.
it.
That's it.
And are there any, like, annual fees or annual, like, CEUs or anything that you have to take to keep this,
No,
title?
no, not yet. I'm thinking that, as I said, it's so fresh, the field, that they still haven't done anything with in terms of professional certifications. The health information management field has several of these certifications, but not the informatics yet. And the reason is that the American Medical Informatics Association, which oversees these competencies and work related to health informatics, they are a little bit slow on doing that.
Gotcha.
But
Well, they can take their time because as
yeah,
licensed therapists, I can tell you it's a pain in the booty. Lauren says that's great. Yeah, we don't want to have to pay annually or biannually and have to keep taking more tests. So I love this field just for that.
yeah.
Awesome. Well, any more questions here? And as we sort of finish up here, and anyone puts in their last questions, and if you're watching on the replay, you can always put in your questions. We do check the comments. So if you're watching on Facebook or YouTube or anywhere else, feel free to always ask your questions now or later on the replay. And then while people are typing into the chat, any last words of wisdom or anything else, Sakis, you want to share?
Don't be afraid. Do it. If you're thinking about expanding your career, find the program that best addresses your needs and go ahead. It's don't be afraid. That's what it is, and you can start as small as you like. There are certificates, there are degree programs, master degree programs.
I love it. I love it. So we got um what about learning like SAS? Is it helpful to learn like Monday and Asana and different like SAS software, or like is it helpful to learn coding or take certain classes beforehand?
The way I see it, at least in our programs, it's we are not creating data scientists. As I said, we're not going to create somebody who will develop statistical models to mine the data from the entire electronic medical record to spit out a number. The way we approach it is more managerial aspects. We're going to see higher level people, higher level positions, right? So, and we're going to show understanding. We're going to teach understanding of what is the process of an analysis. What do we need to do to be able to do all these data mining things that we're saying, right? So if we use SAS as a tool, as an example, that SAS can be anything else, it can be even Excel, right? But we partner with SAS, so we are, because SAS is it's a leader in business analytics and analytics software. We like to have this partnership. Um, but more advanced courses, more advanced, they go to different types of positions, and that's more in data science, and they require a different background in computer science and statistics and math that we don't support that much.
Gotcha, gotcha. And then Kieran asked, "What's the best university for informatics?" And I know you're going to be a little biased, but maybe what you could do for this is say, like, why people should maybe choose your program over someone else's program.
We are the first. We are the first. And we are the first medical school, right? Because that's why I'm talking about clinical mostly, right? We're the first medical school that did this. We have practicing clinicians teaching. We have people in the field who are teaching. I'm developing courses, and I'm doing that every day, and I'm doing more every day. We have partnerships with faculty from different colleges who are also practicing and researching and publishing. So we are in the field. We know what we're doing. We are accredited.
I love it. And
So
we've had several people say USF is the best. So
USF is the
impressive.
best. USF is the best.
Awesome. Well, thank you so much, Sakis. I mean, you're a wealth of information. We really appreciate you coming on so much. Everyone in the comments, if you could just thank Sakis here for coming on. We really appreciate his time. And thank you everyone for your great questions and attending. And if you have more questions, feel free to let us know below in the comments. But Sakis's email is right here as well. If you have any questions about the program, feel free to reach out specifically to the information you see right here on the slide, the phone number or the email or even the chat. Awesome. Thank you so much, everyone, and have a good evening.
Thank you. Bye bye.